Assalamualaikum warahmatullahi wabarakatuh. Good morning, madam. Thank you for your time. My name is Wan Farahim binti Wan Ismail, and today I will present about syphilis disease. Syphilis disease. Of syphilis disease. Syphilis is a sexually transmitted infection (STI) causes by the bacterium Treponema pallidum. Is it transmitted through vaginal, anal, or oral sexual contact with an infected person? Direct contact with a syphilis sore from an infected pregnant woman to her baby, congenital syphilis, rarely through blood transfusion. Infection developed in 4 stages: primary, secondary, latent, and tertiary. Each stage can have different signs and symptoms. Without treatment, syphilis causes serious health problems. It can permanently damage your heart, brain, muscle, bone, and eyes. Symptom. The symptom depend on the stage of infection. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. Each stage has different signs and symptoms. Primary stage. During the first stage of syphilis, you may notice a single sore or multiple sores. The sore is a location where syphilis enter your body. This sore usually occur on or around the penis, vagina, anus, rectum, lips, or in the mouth. Sore are usually, but not always, firm, round, and painless. Because the sore is painless, you may not notice it. The sore usually lasts 3 to 6 weeks and heal regardless or whether you receive treatment. Even after the sore goes away, you must still receive treatment. This will stop your infection from moving to the secondary stage. You may have skin rashes and or sores in your mouth, the vagina, or anus. This stage usually starts with a rash on one or more areas of your body. The rash can show up when your primary sore is healing or several weeks after the sore has healed. The rash can be on the palm of your hand and or the button of your feet and look like rough red and reddish brown. The rash usually won't itch, and it's sometimes so faint that you won't notice it. The symptom from this stage will go away whether you receive treatment. Without the right treatment, your infection will move to the latent and possibly tertiary stage of syphilis. Latent stage. During the latent stage of syphilis, patients have no clinical symptoms, but serological tests remain positive. Without treatment, you can continue to have syphilis in your body for years. Is a tertiary stage. Most people with untreated syphilis do not develop tertiary syphilis. However, when it does happen, it can affect many different organ systems. These include the heart and blood vessel, and the brain and nervous system. Tertiary syphilis is a very serious and would occur 10 to 30 years after your infection began. In tertiary syphilis, the disease damages your internal organ and can result in death. A healthcare provider can usually diagnose tertiary syphilis with the help of multiple tests. Diagnostic of syphilis. Syphilis diagnosis is based on the person's clinical and sexual history, physical examination, laboratory testing, and sometimes radiology, as symptoms are not common or noticeable. Syphilis is caused by the bacterium Treponema pallidum. Laboratory tests for the syphilis include direct detection of Treponema pallidum through a microscope or indirect methods such as blood tests. Rapid tests are also available and can provide results in minutes, facilitating immediate treatment initiation. Identifying asymptomatic infection through laboratory or rapid tests and providing adequate treatment of positive cases will prevent further transmission and complication, as well as adverse pregnancy outcome, including congenital syphilis. Current diagnostic method. The current diagnosis of syphilis based on combination of clinical assessment and laboratory tests. Since Treponema pallidum cannot be routinely cultured in the laboratory, diagnosis mainly relies on serological testing. support by direct detection and molecular method when necessary. Clinical assessment is the first step in diagnosis and include patient history, physical examination. Clinical assessment help in identify patient at risk but cannot confirm syphilis. Laboratory tests include non-treponemal test, RPR VDRL used for screening and monitoring treatment, treponemal test, TPHA used to confirm infection, PCR used in selected cases such as yearly congenital or neurosyphilis. Explain detail about laboratory tests. Non-treponemal test, RPR or NVDRL. These are initial screening tests used to detect non-specific antibodies produced during syphilis infection. They are inexpensive, rapid, and also used to monitor treatment effectiveness as antibody titer decrease after successful treatment. Treponemal test. These are confirmatory tests that detect antibodies specifically against treponema pallidum. They are highly sensitive and specific but usually remain positive for life, even after successful treatment. Polymerase chain reaction, PCR. PCR is a molecular test that detects the DNA of treponema pallidum. It's mainly used in selected cases such as yearly syphilis, congenital syphilis, and neurosyphilis, and especially when serological test results are inconclusive or when direct detection of the bacterium is needed. Standard of Assalamualaikum warahmatullahi wabarakatuh. Good morning, madam. Thank you for your time. My name is Wan Nur Farahim binti Wan Ismail, and today I will present about syphilis disease. Syphilis disease, dark field microscopy (DFM) was considered the gold standard for diagnosing primary syphilis because it directly detects live treponema pallidum from fluid collected from syphilis lesion. It provides rapid and highly specific result and can identify infection before antibodies develop. However, it required fresh lesion sample, specialized equipment, and experienced personnel. It is also not suitable for oral lesson and it rarely available in routine clinical practice today due to this limitation. Today, no single test is considered the gold standard for diagnosing syphilis at all stages. Future direction of diagnosis for syphilis. The future of syphilis diagnosis focus on developing faster, more accurate and accessible diagnostic method while maintaining the important role of serological testing as the primary approach for screening and diagnosis. Emerging molecular technologies including digital PCR, point-of-care molecular test, multiple PCR have the potential to improve early detection, identify antimicrobial resistance, and enhance disease surveillance. In addition, AI may support more accurate interpretation of test results and clinical decision making. Future improvements are also expected in automation of treponema pallidum particle agglutination and rapid plasma reagent (RPR) testing, enabling faster turnaround time and more standardized results across